So how much can I get for a trade? Well, I don't think bananas are worth what you think they're worth. If shopping for a new car drives you bananas, head to Community Auto Group in Mason City. We have the best selection of new and pre-owned vehicles. And you know, with Community, you're getting a straightforward deal from a straightforward dealer. I'd like to buy this car. No? Seriously? Next time I'll skip the monkey business and go to Community Auto Group.
From the very beginning of the session, Governor Branstad and I made our health care principles well known. Improve access to care, reward quality care, encourage Iowans to take ownership of their own health, and to be sustainable over the long term. The Iowa Health and Wellness Plan accomplishes all of these goals and does so with bipartisan support. This plan allows Iowa families with low incomes to do more than just access health care. It allows Iowa families to access quality health care locally with incentives to improve their health care. As Governor Branstad and I have traveled to all 99 counties in this state, we have heard time and time again the importance of annual physicals, health risk assessments, and preventative medicine. This plan provides all of those health behaviors. We also have heard how important it was for this plan to be sustainable for the long term. I truly believe that the leadership is more than just making promises, that leadership is delivering sustainable results. And now it is my great honor to bring to the podium a former colleague of mine, Senator Amanda Reagan.
Thank you. It is a great honor for me to participate in the bill signing, which embodies the good work and from many good people and for a good portion of time. And I know the executive and legislative branches of government worked for many years on various proposals and ideas of how Iowa can best serve our citizens receiving quality health care services. Representative Uppmeyer and I have been involved in those discussions since we were both elected in the legislature over 11 years ago, and probably before that. And I know scores of you gathered here today were strong advocates, and I looked around the room, I couldn't name all of the people that have been strong advocates of changing the Iowa healthcare system. Today, we will codify our best effort with the signing of the Iowa Health and Wellness Plan. Ultimately, an additional 150,000 of our fellow Iowans will be eligible to receive health care at reasonable and affordable costs through an improved care delivery system. We have arrived here today at the junction with the people at the best part of this whole arrangement has been because we have arrived here today at the junction where people of goodwill forged good public policy through the application of good common sense. It just doesn't get any better than that.
Good morning. It is so great to be here, and this is indeed a day of thank yous. First, let me begin by thanking everyone engaged with the Mason City Clinic, the staff, all employees, the docs that work here for inviting us to be here today and making it such a special day. I have to tell you, it's so nice to be back here, and it's so nice to see so many faces of people I used to work with every day. And I miss all of you, and so it's good that I take you with me every day to the legislature. Thank you to Governor Branstad and Lieutenant Governor Reynolds. Their vision and leadership this year has just been so helpful in showing us a path and having participation from all over the state throughout the year so that we very clearly understood what Iowans wanted in the healthcare system, and we're able to put that together. Senator Reagan, thank you for all your hard work. I think Amanda's exactly right. We've worked together on health issues ever since we were elected. We both came from kind of similar backgrounds in service to Iowans in the North Iowa area in a little different ways, but we've always worked on these kinds of topics, so it made it far easier to come together. And I think the caucuses for working so closely with us and doing the job that we need to do at the end of the day. Sometimes it's a challenge when we're moving fast and furious for taking the buy-in, but the caucuses stepped up and understood what we were doing and participated and supported us. So we appreciate that. Thank you to Representative Heaton and to Representative Miller, who are not here today, but on the House side and their counterparts on the Senate side, put together a very good budget for us to work with this year, which helped make all of this possible as well. It's a responsible budget and one we believe is sustainable. A special thank you to Representative Walt Rogers, who is not here today. Oh, is he? I can see him back here. Thank you, Walt. Thank you. Now everybody knows who you are. So thank you very especially to Representative Rogers for actually shepherding this through the House and persevering and hanging with us as we pull this all together. The Iowa Health and Wellness Plan is something that I can't imagine how anybody without any background in healthcare could pull this all together, but he worked so hard and talked to all the right people and made it happen. And I just thank you to him, Paul. Thanks so much. He stepped up and did everything we asked him to do. At the beginning of the year, the governor laid out a plan for a health system that would meet the needs of Iowans, was sustainable, and put a good system in place that would allow for continuity and a high quality care, and not just waiting for emergencies to happen for people to actually receive that care. His plan provides a really good, sound goal for us to work with, and with the expiration of the Iowa Cares program, which those of us in North Iowa saw lots of problems with, it created a real opportunity for us to move forward and come up with a better plan. So we utilized that structure. We worked in the House and the Senate and figured out which things we could do, where we had agreement, and focusing on the agreement. And I think that was the thing that was so helpful. And I tell you, our staff was absolutely invaluable in that process, because when we had questions about how something would work and how we would roll it out, they dug in, and by the time we got together again, they had all the answers for us, and we were able to move forward. So, Aaron, thank you. The Iowa Health and Wellness Plan does improve the quality and the continuity for individuals under 100% of poverty, those neediest Iowans who previously might not have had health insurance and didn't access the healthcare system in a way that promoted wellness. This will promote wellness. We do see this as a better plan than simply expanding a decades old and a bit archaic system that we currently have. So this will be a good thing to do.
Linda Upmeyer, thank you very much. Good morning to all of you. It's great to be here in Mason City with the sun shining, with a special bill signing. And I want to thank everybody. I want to thank our hosts here from this clinic. Thank you for hosting us here. This is a great setting to do this. We appreciate the good work that you do. And I want to thank all of you in North Iowa for your leadership. As you know, I grew up here in North Iowa, and this is really the kind of the healthcare center for this part of the state. And you do great work here. Your leadership in health and wellness is essential to success, and I want to particularly thank the two that you've already heard from this area, Senator Reagan and Representative Upmeyer, for their leadership. I think up until the end of the session, very few people believed this could really come together. That we would actually get a bipartisan agreement and that we would have a bill signing of this magnitude. But it is a tribute to the hard work and perseverance and the cooperative environment that we had, and especially the bipartisan work in the legislature that led to this compromise. Senator Reagan was dedicated to the process and was instrumental in making the health and wellness plan a reality. And of course, Majority Leader Altmaier was in a very important and key position, and this is something that's near and dear to her heart. They both played a very key role. I want to acknowledge Senate President Sam Yocum, who also played a very important role, along with representing that rewards things that are going to preserve health instead of just paying for procedures, which is kind of the way the health system has been in the past. The more procedures you have, the more you get paid. It was almost a perverse system that didn't lead to healthier outcomes. In just 2 short years, since we set the goal of being the healthiest state, Iowa has moved from 19th to 9th in the Gallup Healthways Health Index. I believe that Iowa Health and Wellness Plan, which was approved, will aid us in our goal to become the healthiest state in the nation. And we know going from 19th to 9th was easy compared to going from 9th to 1st. So we do have a big hill yet to climb. But I think we have laid the groundwork, and hopefully we're seeing the buy-in. And I want to say how much I appreciate the partnership we have with the Healthiest State Initiative. The companies like Wellmark Blue Cross Blue Shield and Hy-Vee and many others, and communities competing all over the state to be blue zones. I think it's an important part of that. The plan that we're signing today increases access to high-quality, modern health care and encourages people to make the kind of right decisions. And the Lieutenant Governor mentioned things like physicals and health risk assessments and just making good choices in terms of nutrition, exercise, not using tobacco products, all those kind of things. This plan increases the number of Iowans who will have private insurance. And through the exchange program, there are tax credits for that. We think that's a positive step forward as well. Our insurance commissioner will be working on that. In the front row, we have the leadership from the Department of Human Services will have the responsibility of administering and overseeing this and getting the waiver that we must get from the federal government. I know that Chuck Palmer and Jennifer Vermeer and our chairman of the Commission of Human Services, former Senator Art Gracious is a former senator from this area. He's a great example of somebody that's physically fit and is still actively involved with the committee. Art, thank you. This plan indeed provides incentives for healthy behaviors and rewards Iowans for taking ownership of their own health. This plan will lower the tax burden for Iowans statewide, and there are times throughout this session when a lot of people were very suspect that this could possibly happen. However, I've always believed that our work as leaders and legislators is all about the art of the possible and the willingness to try to find a win-win situation. Most important, something that's a win for our constituents, for the people of Iowa. And this bill does exactly that. And so it is an honor and a privilege to sign it at this very strategic location in Mason City, Iowa. Thank you very much. Than the Health and Wellness Plan. It's got the entire Health and Human Services appropriation. We haven't really talked about that, but we will be releasing a statement later today about that in the morning.
you.